Hello everyone. In this video we are going to study about dysmenorrhea and disorders of menstrual cycle. Define dysmenorrhea and mention its types. What do you mean by dysmenorrhea? Dysmenorrhea means painful menstruation. The menstrual cycles which a woman goes through, when it becomes painful, then this is known as dysmenorrhea. Practical definition include painful menstruation of sufficient magnitude so as to incapacitate day-to-day activities, which means the menstrual pain is so severe that the person cannot carry on her day-to-day activities. Types: primary and secondary. Along with that, there is another thing, membranous dysmenorrhea. First we'll be dealing about primary, secondary, then come to membranous. Primary dysmenorrhea is the one where there is no identifiable pelvic pathology, which means inside the uterus, the ovaries and everything which are involved in the menstrual cycle, there is nothing wrong with that. Primary, there is no identifiable pelvic pathology. Mostly in adolescents 18 to 24 years of age. Confined to ovulatory cycles. Starts with the onset or just before the menses. So primary menorrhea, there won't be any pathology inside. Pelvic pathology won't be present. It is found in the people who are adolescents, that is 18 to 24 years of age, young people, and it is only during the ovulatory cycles, that is during the menstrual cycles. It starts with the onset of the cycle or just before the menses it starts. Primary dysmenorrhea starts. Pain is related to dysrhythmic uterine contractions and uterine hypoxia. So what happens in primary dysmenorrhea is dysrhythmic uterine contractions. The uterine contractions are not regular, they are dysrhythmic, and uterine hypoxia. Pain is usually cured following pregnancy and vaginal delivery. Why are they saying that the pain will reduce after the vaginal delivery? You can make a guess. Is it because the contractions, they undergo so many contractions during delivery which makes it less? It could be a possible reason, but there is a damage to the nerve. Once there is a damage to the nerve, the pain automatically reduces. I'll be explaining to you in detail in the next slides. Secondary dysmenorrhea. Now let's move on to secondary dysmenorrhea. Menstruation associated pain occurring in the presence of pelvic pathology. Here the pain with the menses is there, but some underlying pathology is present in secondary dysmenorrhea. What are all the causes? Endometriosis, adenomyosis, pelvic adhesions, uterine fibroid, endometrial polyp, IUCD in utero. These are all the causes for secondary dysmenorrhea, which means these are all the pelvic pathologies, the abnormalities which have gone under the person's internal pelvis. That is endometriosis, adenomyosis, pelvic adhesions, uterine fibroid, endometrial polyp, IUCD in utero. It is mostly in elderly or Paris women. We saw primary was in adolescents 18 to 24 years. But here it is elderly Paris women which will be more than 30 years of age. Pain starts 7 to 10 days before the onset of menstruation. Primary, it starts with the onset or just before, a day before or something like that. But here it starts 7 to 10 days before. No systemic discomfort, which means the person doesn't have nausea, vomiting. Systemic is like the body's discomfort won't be there. Membranous dysmenorrhea. Let's move on to it. It is a variety of spasmodic dysmenorrhea where there is casting of big pieces of endometrium. In membranous dysmenorrhea, there will be casting of the pieces of the endometrium. This is said to run in families. Define membranous dysmenorrhea, writes its causes. It is a variety of spasmodic dysmenorrhea, as we read there. Again, the question is being repeated. Variety of spasmodic dysmenorrhea. There is shedding of cast of the endometrial cavity. Why does this happen? It is because there is absence of fibrinolytic system. It is said to run in the families. What are the causes for the membranous dysmenorrhea? There is obstructive factor, there must be some obstruction, hypoplasia factor, reduction in the number of multiplication of cells, muscle ischemia factor, if the blood supply to the muscle is not proper, to the endometrium is not proper, neurogenic factor, nerve pathology, psychological and social factors from the environment, constitutional factors, the person's body buildup, endocrine factors, the hormones. So these are all the factors which are in relation for the causes for membranous dysmenorrhea to occur. Now let us see a differentiation between primary and secondary dysmenorrhea. We just have an idea. We actually learned about primary and secondary dysmenorrhea. We will be dealing with the differentiation in details, like the days, how many days and everything. So first let us compare and then go on. Primary, patient is usually young, 18 to 24 years, rare after 30 years. As we read earlier, adolescent patient, that is 18 to 24 years. Secondary, patient is usually elderly beyond 30 years. This point is clear. Let's move to the next point. Painful menses usually occurs years after menarche. For example, the girl got her first menses, that is menarche, when she was 13 or 14 years, 12 years old. But then the primary, that is dysmenorrhea, primary dysmenorrhea, the painful menstruation will start years after. When she is around 18 years or 20 years, after the years of menarche, the painful menses starts. In secondary dysmenorrhea, painful menses occurs after a period of painless menstruation. So first there will be painless menstruation. Later on, the painful menstruation, that is dysmenorrhea, starts. That is secondary dysmenorrhea. Hope the points are clear. Primary in adolescent women 18 to 24, and here it is elderly above 30. Second thing, it occurs years after menarche. Here it is after the period of painless menstruation. First painless, then comes painful. Third point, patient starts 1 to 2 hours the pain will start 1 to 2 hours before the onset of menses, usually continues for 12 to 24 hours, then gradually gets less. As we read earlier, just before the menses, which means 1 to 2 hours before the lady gets the menses, the pain starts. And it will continue just for 12 to 24 hours. That is, first day of her menses will be very painful for her. Then second day, third day and all, it gradually reduces. Then we come to secondary dysmenorrhea. Pain starts 3 to 4 days before the onset of menses, after which the pain usually gets less. Pain is colicky and crampy, occurs in hypogastric region and radiates to thighs. There may be lower backache. So how is the primary dysmenorrhea pain? When the person says in the clinic, the lady comes and she tells you the pain is colicky, it is crampy, it occurs in the hypogastric region, and then the pain is radiating to her thighs, and she's also having a lower backache. Then so you have to rule out as a primary dysmenorrhea. When the patient says that pain is dull, achy in the back and the lower abdomen without any radiation, when there is no radiation, then it is secondary dysmenorrhea. Hope it's clear, guys. Pain will be colicky, crampy, hypogastrum and radiate to the thighs and lower backache in primary. Secondary, there will be dull, achy and no radiation. This is what you need to remember. Next, intermenstrual period is free from any pain. She got her menses, then till the second menses, the next menses come, the intermenstrual period what the person is having, it will be free from any pain. Intermenstrual period may have backache and lower abdominal discomfort. Her menses is over. The dysmenorrhea doesn't end. The painful menstruation will end, but the effect of it will be like even during the intermenstrual period there will be backache and lower abdominal discomfort. Constitutional symptoms, nausea, vomiting, diarrhea and sometimes fainting may be present along with painful menses. So the constitutional symptoms, as I told earlier, what are all the things here? Nausea, vomiting, diarrhea, along with that fainting. Here there won't be any constitutional symptoms like what we read here. No systemic discomfort in secondary dysmenorrhea. So here the constitutional symptoms won't be present. Instead of the constitutional symptoms, there will be menorrhagia, white discharge, and infertility. These things you need to remember. Hope the differentiation is clear to you guys. Membranous dysmenorrhea causes, dysmenorrhea's definition, types, and everything is clear. In the next lecture, we are going to continue the chapter.